Rhinoplasty is a very commonly performed procedure and is undertaken in a very safe environment under general anaesthetic. Now, it's important because this is a cosmetic operation to change the form of the nose, and it's important that we also keep safety as paramount throughout the operation. So that means that I work with anaesthetists that I regularly work with on a regular basis to ensure that that aspect of the surgery is undertaken well. I use techniques that minimize risk and ensure safety of the patient throughout the procedure. And also after surgery, I ensure that there are correct medications such as antibiotics and topical antibiotic cream that are used to prevent infection. And importantly, that patients have a point of call to contact if they're in any trouble. Now, that will be often the hospital that I'm working in and straight after the surgery, because there can be problems with bleeding or irritation around the nose, and that patients have access to myself via my secretary or via the hospital as well. So if there are any concerns, they'll be able to pick up the phone and contact someone. Then that's really important, because with any surgery there are risks and there can be unforeseen consequences after an operation, such as severe bleeding or discomfort. But it's important that as experienced surgeons undertaking these operations before, I know what things to look out for and what things are worrying and what things aren't. So it's important that patients are able to have expert input in regards to this, to know actually this is something that's concerning where I need to review sooner, or not to worry, this is something that routinely occurs during surgery. And that's therefore making the surgery safe throughout, from the time of the operation right through the recovery period.